Okay, I'm Dave Eggen. I'm the Executive Director for Friends of Medicare in the province of Alberta. Very sort of vague. Well, Mr. Duckett, who's in charge of Alberta Health Services, was being clever, I think, in a diabolical sort of way, because he has two things he wants to accomplish. He wants to make deep cuts on public health across the province, and he wants to move that money and those resources over to private contractors.
We're announcing today the accelerated expansion of community living options this year and over the next 3 years. We're opening 800 beds in the community, and amongst other things we'll be able to release about 60 beds to help ease pressure on our emergency departments this winter. This means, as we open the 800 community beds, we will not be staffing about 250 to 300 hospital beds that aren't being used to care for acutely ill patients.
So in one fell swoop at this press conference, he started that process. He's cutting 300 or 350 beds across the province from public hospitals and moving those resources into private contracts to private contractors to provide that health service. And so you're reducing the amount of public health that people receive, the quality of health, and you're taking hard-earned public money, tax dollars, and giving it to private contractors, who will probably charge you extra to stay in their facility as well. It's a great deal.
The 800 beds, how many are actual beds in facilities, and how many of those are home care placements?
About, of the 800, I'd say 780 or so will be beds in facilities, maybe 750. We've got patients occupying acute hospital beds who don't need to be there, and it's not the right place for them to be. And secondly, of course, by doing so, we free up resources as well.
So how are you going to accommodate patients waiting in the hallway if you've closed 300 beds?
So there's 800 new spaces coming online. How many of those are, I guess, going to be created now as opposed to what was announced before the last provincial election when the government promised to create 600 new continuing care spaces? Well,
all I'll say is what we're doing with this strategy is providing the money to open those. They're not open now, so there's actually, if I use the Garrison Green example, there's actually 200 additional beds we're talking about.
Get back to the
How many of these facilities actually exist right now?
They all exist right now.
Because we were at one this morning and it's a hole in the ground.
I mean, you can use the word bed interchangeably and with great liberty, right? A bed in the Royal Alec Hospital is a very specific entity that is supported by healthcare professionals, and you get top quality treatment. Let's not forget, here in Alberta, still you get some of the best healthcare in the world if you're in a hospital, if you're under the public system. Once you step over the threshold of the Alec, let's say, and into a private place, all bets are off.
Dr. Duckett, how firmly committed are you to that number of 300 bed closures, or is that a number that could fluctuate?
That's an upper limit.
Upper limit?
It's going to be lower than that. Somewhere between 250, 290 is my view. It won't hit 300, but yeah, it's less than 300.
Now, why do you say that? What makes you so certain, I guess, that it's only going to be 300? Or not only, but...
Well, we've done the spreadsheets, and that's what we're talking about.
We need more long-term care beds in this province right now. It's absolutely essential. This is not addressing that. This is addressing trying to save money and closing public hospital beds in hospitals. We're still not building that capacity that we need to deal with emergency cases, to deal with the shortage of hospital beds in this province. 20 years ago, we had more hospital beds than we have today. Friends of Medicare has a mandate to protect public health care, and clearly this is an attempt to hijack public health care by moving funds and beds out of hospitals and over to private contractors across the province. Take a look at the list of who they're going to be dealing with. Many of them are private operators who needed that extra money in order to finish their projects and expand their services throughout the province. We call upon Mr. Stelmach to step in on this situation, stop this hijacking of public health care, and make the investment that people want to see. This certainly is a problem, and we will be mobilizing to deal with it.